Well, first of all, the report is now published. It's available on the GMC website, and I would encourage doctors to read the whole report. I think it's important that they see it in the context in which it's been written, and that is that it's about assuring the public that doctors are up to date and fit to practice. I think the sense from the GMC was it's a good time to take stock. It's a good time to look at what's gone well, a good time to look at what we need to perhaps amend and develop, and also a good time to look at anything that needs fixing. I think one of the great successes is that we launched a national revalidation, and what I have discovered in the review that I've done is it's very much owned at a very local level, so that's a great success too. I was surprised and heartened to hear that doctors saw revalidation as a means of underpinning their own professional standing, and I don't know that I'd expected to hear that. I heard that it can be cumbersome. I heard that some doctors feel that the burden in preparing for revalidation can be a little much. Any contact that a patient has with a doctor should offer itself as an opportunity for that patient to be able to feedback on that doctor and for that to go into the portfolio of that doctor. There is evidence already, and in fact the systems, the healthcare systems themselves were telling me that quite a lot of the information that a doctor needs to revalidate sits on computer systems within the hospital they work or wherever it is that they work, GP practice. We should look to see whether we can join those systems up, transfer the information that sits there onto the portfolio for the doctor. I was very impressed as I went around the 4 countries to see that responsible officers and appraisers are already looking to see where there is consistency, to see where there is improvement that they could make. So they're meeting with anonymized appraisals and they are talking to each other about where there's learning, where we could improve the appraisal process, but where we could also get more meaning out of the questions that we're asking. They should expect the same level of support from their designated body, the body they work for, as does a doctor in any other setting. And what I hope that the review will do is will shine a light on the fact that they have that right. I'm assured, on behalf of the public, that doctors are generally speaking up to date and fit to practice.